Good morning to my colleagues, friends, partners. I am Dr. Rufus Ewing. I am the honorary patron of this third annual Global Healthcare Conference. I must first of all extend my sincere apologies for not being able to be there with you in person during these few days of the conference. This is due to circumstances well beyond my control. I'm, however, happy to be a presenter here in this virtual space. So I will move right into my prepared presentation. And if you're viewing this over the internet recorded, it means that I was unable to present it live in person because of that um, extraordinary circumstances. So give me a minute. Share my presentation. Okay, so I will be addressing you today on the subject of cross-sector collaboration in developing and maintaining resilient health systems in the Caribbean region. Um, Change the slide. So it is both an honor as the honorary patron of this conference, and I consider it also a responsibility as a health and policy advocate to stand before you today in this virtual space to address you on an issue that is pivotal to the future of our Caribbean people. You are all gathered there in St. Elizabeth, would be considered to be ground zero for Hurricane Melissa, a place that reminds us that resilience is not theoretical. It is lived, it is tested, and it is built together. That very location symbolizes what is possible when healthcare providers, engineers, architects, policymakers, and communities unite, not only to rebuild, but to rebuild better, stronger, and smarter. So I choose today's topic of cross-sector collaboration in developing and maintaining a resilient health systems and hopes that it could inspire us all to ensure that we build this resilient health systems within our Caribbean region. So let me anchor my remarks around three key messages. Our health systems are vulnerable and fragile and must be strengthened for resilience. Cross-sector collaboration grounded in strong leadership and inclusivity is essential. And we must invest in well-financed, locally driven innovations to withstand climate-related shocks. The Caribbean is often described as resilient, and rightly so. Our people have endured centuries of economic shocks, natural disasters, structural constraints with remarkable strength. Yet, beneath that resilience lies a profound vulnerability. This is the paradox we live every day. We are strong, but we are also fragile. Our small island states within the Caribbean region operate within tightly constrained realities. Limited fiscal space means governments must constantly balance competing priorities: healthcare, education, infrastructure, and disaster response, often with narrow revenue bases, heavily dependent on tourism and external trade. A single hurricane season or global economic downturn can wipe out years of progress. We know that geographic isolation compounds this challenge. Many of our islands depend heavily on imported medical supplies, pharmaceuticals, and specialized healthcare services. And during crisis, whether it's hurricane or pandemics, supply chains are disrupted and access to care becomes compromised. The COVID-19 pandemic exposed this vividly when even basic supplies such as oxygen, personal protective equipment, and vaccines became difficult to secure in a timely and equitable manner. Workforce shortages further constrained our systems. The Caribbean has long struggled with the migration of healthcare professionals, our nurses, our doctors, our specialists seeking better opportunities abroad. In some countries, nurse vacancy rates exceed 30%, and specialist services remain limited or centralized in urban hubs, leaving rural and remote populations well underserved. This creates a system that is already stretched thin before any external shock occurs. So infrastructure constraints, in addition, adds yet another layer of fragility. Many of our health facilities across the region are aging, not well maintained, under-resourced, and not designed to withstand extreme weather events. Hospitals and clinics are often located along coastlines, close to the population they serve, but also directly in the path of rising seas and intensifying storms. And now, climate change is amplifying every one of these existing weaknesses. Scientific projections indicate that the Caribbean could experience temperatures approaching 2.9 degrees Celsius by the end of the century under high emission scenarios. And this is not an abstract number. It translates into more frequent and intense hurricanes, heat waves, and placing additional stress on vulnerable populations, particularly the elderly, children, and those with chronic diseases. Sea level rise poses an equally significant threat. We see that approximately 73% of Caribbean infrastructure is located along these coastal zones, including our hospitals and clinics, our critical transport systems. A projected 0.5-meter rise in sea level could result in loss of up to 60% of our beaches, undermining not only tourism, the economic backbone of many of our islands, but also the physical safety of health infrastructure itself. So let us be clear. This is not just an environmental crisis. It is a health crisis. Climate change is already reshaping disease patterns across the Caribbean. We are seeing increased incidence and geographic spread of vector-borne diseases such as dengue, chikungunya, and in some regions, malaria. Warmer temperatures and changing rainfall patterns create ideal breeding conditions for mosquitoes, expanding transmission seasons and increasing outbreak frequencies. And we know that countries like Jamaica and Barbados and the Dominican Republic have all experienced these periodic dengue surges that overwhelm public health systems. Waterborne diseases are also on the rise. Flooding events common during hurricanes and heavy rainfall contaminate water supplies, leading to outbreaks like cholera and other diarrheal illnesses. And leptospirosis, like in the case of Jamaica recently during Hurricane Melissa. So these conditions often emerge rapidly, particularly in communities with limited sanitation infrastructure. Heat-related illnesses is an increasingly under-recognized threat. Outdoor workers, including those in agriculture and construction, face prolonged exposures to extreme heat, leading to dehydration and kidney injury and cardiovascular strain. Health systems must now contend with conditions that were previously rare or seasonal, but are becoming more and more persistent. Beyond these visible threats lies a more insidious and often overlooked crisis, a silent epidemic of malnutrition in all its forms. The Caribbean has some of the highest rates of obesity in the world. In several countries, more than 30 to 40% of adults are classified as obese, overweight, contributing to high burdens of hypertension, diabetes, and cardiovascular disease and cancer, which are the leading causes of death within our region. At the same time, food insecurity persists, particularly in vulnerable communities, creating a paradox where undernutrition and overnutrition coexist. These are often labeled as lifestyle diseases, but that framing is incomplete and frankly misleading. These conditions are connected to the broader impacts of climate and socio-economic disruption. So when storms destroy crops and disrupt local agriculture, food availability declines and dependence on imported processed foods increases. When families lose homes, jobs, or income, nutritional choices becomes constrained. When communities face repeated shocks, mental health stress rises, leading to coping behaviors such as alcohol misuse and poor dietary habits. Children also miss school, families relocate, social structures weaken. In this context, obesity, poor nutrition, and alcohol misuse are not simply individual choices, they are manifestations of systemic vulnerability. Climate change, therefore, is not only altering our physical environment, it is reshaping how we live, how we eat, how we work, and ultimately how we become ill. It is redefining risk itself. So when we speak about the fragility of the Caribbean health systems, we are not speaking only about hospital or budgets. We are speaking about an interconnected system where environment, economy, society, and health are inseparably linked. And unless we address this interconnectedness, unless we strengthen resilience at every level, our systems will continue to be tested and too often overwhelmed. If there was one defining lesson for the Caribbean, learned through hurricanes, pandemics, and other economic shocks, it is that no single sector can solve our most pressing challenges alone. The complexity of the threats we face demands a response that is equally integrated. Healthcare alone cannot fix this. Government alone cannot fix this. The private sector acting in isolation cannot fix this. Our realities are too interconnected for fragmented solutions. As Takako Ohuyabu of the Takeda Pharmaceutical Company emphasized during a discussion around the UN General Assembly number 20, that climate resilience cannot be built in silos. That statement captures the essence of what is required of us now. It is not simply an aspiration, it is a necessity. And so what this collaboration looks like? I mean, in the Caribbean, every major crisis exposes the deep interdependence of our systems. A hurricane is not just a disaster management issue, it is a health crisis. It is an economic crisis and a social crisis all at once. A dengue outbreak is not only about healthcare delivery. It is shaped by environmental management, by water systems, housing conditions, and environment and urban planning. Food insecurity is not confined to agriculture. It directly influences non-communicable diseases, mental health, and long-term population outcomes. So yeah, so for collaboration, we need all hands on deck. We need the engineers ensuring that we have resilient infrastructure. We need the architects ensuring that we have sustainable designs. We need the technologists implementing our digital health solutions. We need the policymakers passing legislations enabling systems. And we need the clinicians for not only be caregivers, but also leaders and advocates within our community. And we need our communities to come together to be co-creators of their own solutions. So we saw this vividly during Hurricane Dorian in the Bahamas, where the devastation required far more than emergency medical response. Engineers were needed to restore infrastructure, logistics teams to reestablish supply chains, environmental experts to manage contaminated water systems, and social services to support displaced populations. Similarly, during COVID-19 pandemic, Caribbean nations had to rapidly align health ministries with tourism authorities, border control, private healthcare providers, and regional bodies such as PAHO and CARICOM and CAFA. Where coordination was strong, outcomes improved. Where it was fragmented, vulnerabilities were exposed. True cross-sector collaboration, therefore, is not occasional cooperation. It must be deliberately designed into how we build, how we operate our systems. It begins with how we approach infrastructure. I recall in Dominica, after Hurricane Maria, the national vision of becoming the world's first climate resilient nation led to a rethinking of health facility designs. Hospitals were no longer viewed simply as buildings for care, but as resilient structures capable of functioning during disasters and with reinforced construction, independent utilities, and strategic placement. So this is what happens when engineers, architects, healthcare leaders plan together from the outset. Technology also plays a very critical role in this integrated approach. During the COVID-19 pandemic, we all know the whole virtual teleconference, telemedicine expanded across the region. Countries like Jamaica, Barbados, Trinidad, and everywhere within the Caribbean, it allowed for continuity of care when movement was restricted. Regional surveillance systems supported by CAFA strengthened early detection of outbreaks. Yet, this is only the beginning. The future demands integrated digital health systems, electronic records, climate-linked disease surveillance, and predictive analytics. So we need in order for us to be able to guide timely and coordinated responses. Now, policy and governance must enable this collaboration rather than hinder it. And this requires breaking down traditional ministerial silos and fostering coordination across health, finance, infrastructure, and environmental sectors and ministries. Regional, regional cooperation, particularly through CARICOM, has already demonstrated its value, where joint procurement mechanisms during the pandemic allowed for small states to access vaccine and supplies that would have otherwise been out of reach of some countries. And this model of collective action must now be expanded and institutionalized. Healthcare professionals themselves must also evolve. The modern clinician, as I hinted to earlier, the modern clinician cannot operate solely within the confines of clinical care. They must become system thinkers, collaborators, and leaders capable of working alongside engineers and influencing designs, and policymakers advocating for policy changes, and community stakeholders ensuring that we have locally based solutions. In disaster settings, especially, the role of the healthcare provider expands significantly, requiring adaptability, and interdisciplinary engagements. So perhaps and most importantly, communities must be recognized as central partners in resilience, not just passive recipients of services. Across the Caribbean, community networks have consistently been the first responders in terms of crisis. In St. Vincent and the Grenadines during the last volcanic eruption in Soufrière eruption, community engagement was essential in evacuation efforts and the coordination of health responses. These experiences remind us that resilience is built from the ground up. It is not imposed from leadership above. For collaboration to be effective, it must also be supported by intentional training and capacity building. We cannot assume that different sectors will automatically work well together in times of crisis. Yes, sometimes it happens that way that they do, but it's a hit or miss. Training must be integrated, bringing together community responders, frontline health workers, and professionals from multiple disciplines in simulation exercises and preparedness programs. In many settings, even fundamental clinical skills such as suturing and basic limb and life-saving techniques become critical when access to specialized care is disrupted. Preparedness, therefore, must be both broad and practical. At the heart of all of this lies leadership, and not just leadership in the traditional sense. The kind of leadership required now is rooted in stewardship, inclusivity, and vision. It demands leaders who can bridge sectors, who are willing to listen, and who understand that sustainable solutions must be co-created. Too often, those most affected by health challenges are excluded from decision-making processes. That must change. Vulnerable populations, rural communities, and underrepresented groups must have a seat at the table if solutions are to be relevant and effective. Equally important is the need to define success in ways that reflect our local realities. Global frameworks provide guidance, yes, but resilience in the Caribbean must be measured by indicators that matter to our people. Access to care during disasters, continuity of essential services, community preparedness, and system adaptability. Ultimately, the truth is that we already know many of our solutions. We understand the importance of strong primary healthcare systems, resilient infrastructure, workforce development, and community engagement. The challenge is not knowledge, it is implementation. And this is where the final and most important principle comes into play. Empowering people to implement known solutions in ways that work within their own context. Cross-sector collaboration is not just a strategy. It is the only viable path forward. If we are to build health systems in the Caribbean that can withstand shocks, adapt to change, and continue to serve our populations effectively, we must commit to working together, not occasionally, but consistently and intentionally. Because resilience is not built in isolation, it is built together. How do we finance this resilience? Resilience is not built on good intentions, or policy documents, or even strong leadership alone. Resilience requires deliberate, sustained, and strategic investment. If there is one fundamental shift that the Caribbean must make, it is this. We must move from reacting to crisis towards proactively financing resilience before disaster strikes. For decades, our pattern has been largely reactive. Every hurricane, flood, or public health emergency, we mobilize resources, often supported by international aid, to rebuild. The scale of loss is staggering. Hurricane Maria in Dominica in 2017 caused damage estimated at over 200% of their GDP. Hurricane Dorian in the Bahamas in 2019 devastated entire communities requiring reconstruction at enormous cost. These cycles of destruction and rebuilding are not only financially unsustainable, they perpetuate vulnerability. The critical question, therefore, is not whether we can afford to invest in resilience, but whether we can afford not to. This is where we must decisively shift from reactive spending to proactive investment and from external dependency to deliberate cultivation of local innovation ecosystems. So to do this, we must invest in what works. However, we're not starting from zero. Across the Caribbean, there are strong examples of strategic investments that are already shaping more resilient systems. These must now be scaled. A very important initiative in the collaboration between the Pan American Health Organization and the UK Foreign and Commonwealth Development Office in developing smart health facilities across the Caribbean. That was a very important initiative. These facilities are designed to be safe, climate resilient, and environmentally sustainable, capable of remaining operational during and after disasters. In countries such as St. Lucia, St. Vincent and the Grenadines, Belize, even in Jamaica, I think there was one or two in Jamaica already. These health facilities have been retrofitted or constructed to withstand extreme weather events, to maintain independent power and water supplies, and to reduce carbon footprints and operational costs while doing so. So this is a model of forward-thinking investment, one that integrates climate resilience, health system strengthening, and sustainability. However, while impactful, these initiatives remain limited in scale. So there's an urgent need now to finance, expand, and institutionalize this model across our Caribbean region. Similarly, the Inter-American Development Bank has played a pivotal role in financing health information systems and digital health transformation in several Caribbean countries. Investments in electronic health records, data integration platforms, and digital surveillance systems. These are helping to modernize health systems and improve decision-making. These systems are essential for resilience. In times of crisis, the ability to access real-time data, track disease trends, and coordinate responses across sectors can make the difference between containment and escalation of events. Yet, despite these advances, digital health implementation across the Caribbean remains uneven. Many systems are fragmented, underutilized, and not fully integrated into national health strategies. This highlights a critical point. Financing must not only initiate innovation, it must sustain and scale it. Too often we put financing into planning and financing into initiation or so-called implementation, but not enough financing to sustain, maintain, and scale. We must do better. So we need to also focus on our dependency on external aid and support. While international partnerships are valuable and often necessary, we must also confront the uncomfortable reality. over-reliance on external donor funding carries significant risk. Much of the Caribbean's development financing, particularly in health, has historically depended on support from international NGOs, foreign governments, and while this support has contributed to important gains in our health system, it is often subject to one, shifting political priorities, changes in foreign policy, economic conditions in donor countries. A change in administration, whether locally in our Caribbean region, countries in our Caribbean region, or abroad, can lead to abrupt shifts in funding priorities, delays in disbursements, or complete withdrawal of support. We have seen this during our time now with the new administration in the United States. Programs that communities depend on can be scaled back and discontinued, not because they are ineffective, but because they no longer align with external agendas. We saw elements of this during the COVID-19 pandemic as well, when global competition for resources exposed the vulnerabilities of smaller nations, dependent on external supply chains and donor-driven systems. And now, this is not an argument against partnerships. It is an argument for balance and sovereignty. The Caribbean must reduce its vulnerability to external shocks by strengthening domestic and regional financing mechanisms, ensuring that critical health initiatives are not solely dependent on external goodwill. To move forward, our investments must be targeted and transformative. We must scale climate-smart health infrastructure, building on the smart hospital model to ensure that facilities across our region can withstand and function during extreme events. We must accelerate digital health transformation, moving beyond pilot projects to fully integrated national and regional systems that support care delivery, surveillance, and planning. We must invest in local manufacturing and supply chains, reducing dependency on imports and strengthening regional capacity for essential medical goods. This is not about self-sufficiency in isolation. It is about strategic resilience through regional cooperation. And critically, we must invest now in our people. Through workforce development, retention strategies, and the creation of opportunities that encourage our healthcare professionals to return to the region, to remain in the region, and lead within the region. So how do we go about financing this innovation? I mean, to achieve this, we must rethink how innovation is financed. We need financial models that support local entrepreneurs and innovators. We need to encourage public-private partnerships. We need to provide incentives for investment in health and climate resilience. De-risk innovation through supportive policies and regulatory frameworks is very, very important. Regional financial institutions, including the development banks, must play a stronger role in mobilizing resources. At the same time, government must create enabling environments that attract investment while safeguarding public health priorities. Within this context, local innovation matters because it is grounded in our realities, faster to adapt, more sustainable over time, and more likely to be embraced by the communities it serves. So we must finance and invest in our local innovations. Now, let us return to where we are, or where you are right now, where I hope I would have liked to be. There in Western Jamaica, specifically in Silo, St. Elizabeth. The story of Hurricane Melissa is not just one of destruction. So I don't want to highlight all of the negative points of it, but I will to a certain extent. It is a powerful demonstration of what resilience truly looks like in practice. When Hurricane Melissa impacted Western Jamaica, particularly St. Elizabeth and Westmoreland areas and surrounding communities, it tested every layer of the system. Roads were damaged, isolating communities and delaying access to care. Health facilities faced operational strains and they were destroyed. Some of them were destroyed. Water systems were disrupted, increasing the risk of outbreaks of diarrheal diseases and vector-borne diseases. And we all know leptospirosis was an issue at the time. Agriculture, central to this parish in particular, was severely affected, leaving many families without income or security, or food security. I had the opportunity to, in the immediate aftermath of the hurricane, to visit Western Jamaica alongside the Minister of State for Health. What we witnessed firsthand was sobering. Entire communities struggling to regain stability. Infrastructure was compromised. Families were displaced. But at the same time, what we saw, something equally powerful, a coordinated response taking shape in real time. There were numerous international agencies on the ground working side by side with national and local authorities, regional partners, health teams, emergency responders, and community organizations all mobilized. It was not a single effort, it was a collective effort driven by urgency, necessity, and shared purpose. In that moment, vulnerability was undeniable. But what followed is what defines this experience. Collaboration happened. It was not a response led by one sector alone. Health professionals adapted quickly, ensuring continuity of care under constrained conditions. Public health teams intensified surveillance to prevent secondary outbreaks. Engineers and public health and public works team worked to restore roads and stabilize damaged infrastructure, while policymakers coordinated responses and support. Community leaders ensured that aid reached those persons who needed most. The system did not collapse. It adjusted, it adapted, and responded. Communities themselves played a central role in forming informal networks became like the lifelines where neighbors supported neighbors. Local knowledge guided decision making, and in many instances, communities acted as first responders, bridging gaps while formal systems scaled up their response. And importantly, this was not just about recovery, it was about learning and strengthening. Skills were transferred across sectors. Healthcare workers gained valuable experience in emergency and disaster response. Community members were engaged and trained, building local capacity for future events. Multidisciplinary teams, healthcare providers, engineers, logisticians, and social support services worked together in ways that broke traditional silos. Even practical hands-on competencies were reinforced. In resource-limited and high-pressured environments, the ability to perform essential clinical interventions from wound healing to amputations became critically important. These experiences strengthen confidence, competence, and preparedness. So capacity was not only tested, it was expanded. Relationships between agencies were strengthened, coordination mechanisms improved, trust was built between institutions and within communities. What emerged was not simply restoration, but a stronger, more resilient system. This is the lesson of St. Elizabeth and the wider Western parishes. So, what I'd like to say to you folks is that one second. Yeah. Resilience is not a theoretical thing. It is built in moments like these, when systems are under pressure, when sectors come together, when communities are fully engaged in their own recovery. The experience of Hurricane Melissa shows us that resilience is possible when leadership is collaborative, systems are flexible, communities are empowered, and sectors work together with a shared vision. This is not an abstract concept. This is proof that even in the face of significant vulnerability, Caribbean societies have the ability to respond, adapt, and rebuild stronger than before. The real challenge now is ensuring that these lessons are not temporary, that they are captured, institutionalized, and scaled across our region. Because what we witness here in St. Elizabeth should not remain in a moment in time. It should become a kind of a standard for how we build resilient systems across the Caribbean in a proactive manner, however. But I must say that the Caribbean stands at a crossroads, and this is not a distant or theoretical moment. It is here. It is now. It is shaped by the realities we have discussed: climate change, fragile health systems, economic vulnerability, and the undeniable strength of our people. The decisions we make today will determine not only how we respond to the next crisis, but whether we are prepared for it at all. For too long, our region has operated in a cycle of reaction. A storm comes, we rebuild. A pandemic emerges, we mobilize. A system fails, we repair. And while we have shown remarkable resilience in these moments, we must ask ourselves, is survival enough? Because reacting alone is no longer sustainable. We now have a choice. We can continue along this path, responding to crises as they arise, absorbing financial, social, and human costs each time, or we can choose a different path, one that is deliberate, forward thinking, and transformative. We can choose to build systems that anticipate, that absorb, that adapt, and transform. Anticipate by using data science, by using local knowledge to predict and prepare for risk before they materialize. Absorb by strengthening our infrastructure, workforce, and institutions so they can withstand shocks without collapsing. And adapt by creating flexible systems that can respond dynamically to changing conditions, and to transform by using every crisis as an opportunity to emerge stronger, more efficient, and more equitable than ever before. But this is but this will not happen by chance. It requires commitment, real, sustained commitment. We must commit to strengthening our fragile systems, not just physically, but institutionally and socially, so that healthcare delivery remains uninterrupted even in the face of crisis. We must commit to breaking down silos. The challenges we face do not exist in isolation, and neither can our solutions. Health must intersect with climate, infrastructure, finance, and community development. Collaboration must become our default mode of operation. We must commit to investing in local innovations, ensuring that Caribbean solutions are developed by Caribbean minds, grounded in Caribbean realities, and sustained by Caribbean systems. And above all, we must commit to empowering our people because they are the foundation of every resilient system we seek to build. In closing, I would say that resilience is not just about surviving the next storm. It is about ensuring that when the storm comes, our systems stand, our people are protected, and our future is secure. That is the Caribbean we must build. And that is the responsibility we must all share. I thank you for having me to speak to you at this conference. And again, my sincere apologies for not being there in person to fellowship with you and participate in the rich discussions that have been going on through this conference. God bless.